Good morning, everyone. Volume's okay? Okay. So my name's Richa. As Sean introduced, family physician in Calgary for the last 20 years. I have rheumatoid arthritis, and a year and a half ago, I was walking with a cane. I went to see my rheumatologist. I was on 9 pills, and she said it was time to activate my disability insurance, put me on 2 more pills, and said there was a 50% chance I would end up in a wheelchair in 5 years. So something in me just snapped, and I thought, there's got to be better options out there. I started myself on CBD. It was 3 months before my cane was gone, and 6 months before I was off all medications. And there is no way, a year and a half ago, I would have thought that I would be standing here giving this talk wearing heels, because anyone who suffers from arthritis knows that's the enemy. You can never wear heels. Your mobility is limited. My hip was, in the last flare-up, the worst joint, and it was so bad that every time I sat and stood up, the hip hurt. And so anytime a patient had an ailment where I needed to get up from my chair and go examine them, I was thinking, oh God, do you really have a rash? Are you sure you have a rash? Because I don't want to have to get up. My hip hurts. So it's been a remarkable journey, and that's one of the things that started me at looking at medical cannabis. So I'm going to get started with the presentation. I will stand here so you guys can see. So I'd like to just talk a little bit about medical cannabis, history and society, the most commonly prescribed conditions. I want to talk a little bit about patient success stories. That's sort of the talk. I know you're getting multiple talks in the next 2 days, so I don't want to do Cannabis 101. That's tomorrow. But more of just patient success stories. I kind of broke that and started with my own personal story. I want to talk a little bit about patients' concerns about cannabis, contraindications, who doesn't qualify for medical cannabis, and a little bit about ACMPR. So a lot of people think that cannabis is the new big thing. But it's not. It's actually been around 12,000 years. So 10,000 years ago, there's evidence of cannabis turning up in China, and it was used there. In the tombs of the pharaohs, there's cannabis plants found. In almost every single ancient culture, in India, in Ayurvedic medicine, cannabis was used. So we're seeing in healthcare sort of a back to basics movement where we're going back to knowledge that we have historically lost, and cannabis is definitely one of those knowledge bases. In the West, in Western medicine, it was actually legal until the Marijuana Act of 1937. So had you come to see me for a headache or sleep issues or arthritis until the 1930s, almost any pill or pharmaceutical I could have given you would actually have had cannabis compounds in it. And the Marijuana Act of 1937 was more a political act than a medical act. If you have free time and want to Google, there's interesting information about how the cannabis area was taken over by the alcohol lobby because it was just after Prohibition, and the corn producers in the US, and how that was sort of a political thing. But what it did was, after 1937, patients kind of lost access to this. It became a classified substance, and we forgot slowly over the last 80 years about the medicinal parts of cannabis that had been around for thousands of years. And even now, we fight a lot of the stigma, because as soon as you bring up cannabis, the first thing is the image of the pothead, smoking a joint, and the typical image is, the young male sitting there smoking a joint, and we never even think about all the medicinal qualities that this plant showed us for the last 12,000 years. One of the biggest things to know about medical cannabis is that there's actually 2 components to it, THC and CBD. So when we think of marijuana or cannabis, the type that's available on the streets, the type that most people tried at some point in their lives, that was mostly THC. And that's the psychoactive one. That's the one that can kind of give you the stoned feeling. On the medical side, its benefits are it's a very potent anti-nausea, improves appetite. So we use it for cancer patients or anorexia, eating disorders, athletes that are trying to gain weight for their different sports. It's an incredible mood booster, pain reliever. It's stimulating, but it's also a very potent sleep aid. So that's the THC realm, and most people are familiar with that. The unsung medical hero is the CBD, and that's the part that a lot of people don't know about. That's where a lot of the hidden medical benefits come in. So CBD is not psychoactive, which means it does not give you a high, you don't feel stoned, it doesn't change your perception of reality. And it's a very potent anti-anxiety, anti-inflammatory, anti-seizure, again, no impairment, and it's a great pain reliever. So on the point of anti-inflammatories, generally when you have inflammatory conditions, I'll encourage people to have, anti-inflammatory diets with turmeric, garlic, ginger, cinnamon, these things put together. But CBD is equivalent of all of that put together times 50. Like that's how potent an anti-inflammatory CBD is, even in smaller doses. So one of the key things to know about the cannabis plant is that there's two very, very different components to it, CBD and THC. And on the medical side, you can get different combinations of this. So you can get 100% or almost 100% THC, or almost full CBD, and then different proportions in between 1 to 1, 50 to 1, 5 to 20, and so on. So the different combinations can be used for different conditions and help in different times of day as well. The other part, I'm standing over here so it doesn't block your way, are terpenes. So terpenes are additional compounds that are in the cannabis plant. And each terpene has different properties. So when people come in to talk about different medical conditions, we'll suggest that they look at the different terpenes for what they're looking for. So alpha and beta pinene with alertness and creativity, so often used for adult ADD type of symptoms, people that are tired in the daytime, having trouble focusing. One of my favorites is the bottom one, the humulene, which is an anti-inflammatory but also is an appetite suppressant. So we see use it for arthritis, but one of the things that helps arthritis is weight loss. So if people are overweight, even a 5-pound weight loss. So if you have knee issues, if you lose 5 pounds, that's actually 20 pounds off your knees. And so sometimes even just the 5 pounds weight loss can make your knee arthritis better. So the humulene is an incredible terpene. But when you come through our clinic, we do a extensive education process where we'll talk to you about terpenes and CBD and THC and when to use which one for your particular medical issues. So at Harvest Medicine, we've seen about 18,000 patients, which is a huge chunk of all the medical cannabis patients in Alberta. All of Alberta only has about 65,000 medical cannabis patients. And our biggest proportion has been for mental health. So we have over 10,000 patients we've seen for anxiety and depression. And that doesn't have to be the sort of anxiety that gets labeled or gets treated with anti-anxiety or antidepressant medications. It's just that feeling of being wound up, not being able to function at your best capacity. Pain management is the next big thing. So chronic pain, arthritis, back problems, knees and joints. That's almost 10,000 people as well. The next biggest chunk is sleep issues. So sleep's been, a major issue for most people by the time they start to hit their 40s and 50s, but we also see a lot of young people. So about 4,500 people dealing with sleep issues. And the next big category is gastrointestinal, so irritable bowel, colitis, Crohn's, food allergies, intolerances, celiac. So it's been interesting to see people coming from different journeys and looking at the numbers. So next up, I have a couple of videos of patients just talking about their experiences.
So my name's Aaliyah Dunfield, and I originally came in because I had chronic inflammation. So the chronic inflammation had spread from my intestines all the way through to my wrists, and so I'm still waiting actually on carpal tunnel surgery, and then it went up into my head, swelled up my entire face, and it got so bad that I had chronic migraines. So I had a horrible, debilitating migraine every single day from November until March. And it was to the point where I couldn't get out of bed most days. I couldn't see properly. I'd gone to the doctor and tried pretty much everything, and she just said, it's just inflammation. So she recommended that I try the CBD drops. And within about a month and a half, I started noticing that the migraines started to go away, which is life-changing. So I started my cannabis therapy, I think it was about February. I'm up to, on the oil, about 7 milliliters a day, 7 to 8 milliliters a day, and then still the THC, the 1-to-1 ratio at night. The inflammation was so bad even that it felt like I had a UTI, but it was just because everything was so swollen and just kind of pressing on different parts of my body. So that has gone away. There's even some nights where I don't take the 1-to-1 ratio at night because I'm able to sleep by myself, which is, I can't even, it just makes me cry even to think of how much has changed my life. I couldn't work up until a couple of months ago. For a year and a half, I wasn't working. I was in so much pain and so sick all the time. And now I renovated our house because I feel so good. And I would just suggest to anybody that you just need to try it. And do some of your research too to show you that it's really not something as harmful as that they've kind of been pushing for the last 20 years or so. The Canna Geniuses were awesome. They sat me down and went through a system that allowed me to pick a producer, and they helped me pick one that was really simple. They registered me, so I didn't have to worry about doing any of that stuff. All I had to do was order it, and even ordering what I needed, they helped me choose what's going to work best for me, what I actually need. They told me about the benefits of the different strains and the different products that are out there. So, I don't know where I would be without the help of the Canna Geniuses, simply because I don't know anything about this stuff. I just want it to make me feel better, and I don't want to have to think and research of where to go and who's trusted, who's good, who's going to fit me, who's going to make it simple for me, all those things, and they help me all the way through. And it's really nice too that the doctor here actually cares about my progress, and she really cares about am I doing better, and what different kinds of things can we try so that it just is more effective, which is, it's great. It's really great.
So the word Canna Genius that she was using is our internal word. So when patients come through Harvest Medicine, there's a 2-step process. You see the doctor, you get your medical assessment, and see if you're an appropriate person for medical cannabis. And then when you have a prescription, the next part are people, we call it Harvest Medicine or HMed, Canna Geniuses, and so they're the experts in the products. And on the medical side, and there's over 70 different licensed producers, and between them over 500 different products. So for someone just coming off the street, it's an incredible process to navigate, and that's their job, to help navigate and to help put the right patient with hopefully the right licensed producer to meet their needs. One more patient story.
To me, the thing that is so great about with the CBD oil, for me, from my experience, everything just kind of happened organically. So when I got it, took it that first day, and got to the end of the day, and my wife said, how was your day? And I tossed her my Fitbit, and she looked at it and said, well, I mean, this is 10,000 steps. I mean, you've been doing 500 to 1,000. Yeah, my name is Brett, and I have a condition that's called neurofibromatosis type 2. So the short version is NF2. It affects things like your hearing, your sight, your balance, and there's quite a laundry list. It's a prescription for CBD oil. It's helped me in that it reduces the swelling and just overall feeling better. Feel more like myself today than I did. I'm about 6 weeks in. So the other plus that I hadn't mentioned is I've taken sleeping pills for at least 8 years, probably closer to 10. It isn't on that list that you have, like as far as the CBD oil helping with sleep, but as of today, my prescription for sleeping pills is usually 90 pills, and it's dropped from a 15 milligram dose down to a 5 milligram dose because I don't need them. I just fall asleep. I guess I expected that it was going to be something that was more just pushing the buying and like being able to acquire. And it turned out it wasn't. It was 100% dealing with me and my condition and more medical perspective, not the, oh, well, here, I've seen you, it's good enough, get a card, go get your stuff. To those who are on the fence about medical cannabis, I mean, it works. I mean, the reason why I wanted to explore that avenue is because everybody that I've been seeing for the last 2 years, no one's suggested it or endorsed it, or so it was just something that I looked up on my own, and yeah, it's pretty incredible. And to me, if you can take something that's natural versus something that is chemically produced, yeah, that's a win.
So it's not uncommon to see people break down in tears when we do assessments and follow-ups. It's one of the things that really takes me by surprise. How touched people are at how much cannabis has really helped them. But the social stigma still continues. So in terms of when thinking about getting testimonials, a lot of people are shy because they're in occupations where they're not sure if it's okay for people to know that they're taking cannabis. Had a teacher yesterday who was sobbing out of relief for her chronic anxiety. And when I said, hey, do you want to do a testimonial? She said, no, my God, can you imagine what the parents at the school would say? So we have a couple of patients there, but mostly I've written down a few success stories of anonymous patients. So the first is a 67-year-old lady who surprised me by saying that she had severe, debilitating daily migraines for 40 years. So she started that in her early 20s and just She said, I haven't had a migraine-free day that long. She was referred to us by the chronic pain clinic. She'd been to the headache clinic. She'd had no success. And she tried almost everything that was out there, any medicine I could think of, narcotics. She'd done Botox. She'd actually done hypnotherapy because she thought that might help as well. So she came in and she started taking CBD daily and then THC for when the headaches come and for sleep. And she surprised me that at the 3-month follow-up, which I thought was a little early, she had had no headaches at all. She said, I've had no headaches for the past few weeks. It took a while again for the CBD to kick in, and not a single headache. And Calgary goes through Chinooks, and most people that have migraines know that they become human barometers, and we can feel when the weather's about to change. And at her 9-month follow-up, she still had no headaches. She'd had a couple of tension headaches. She drank some water, took some Advil, but no migraines, no debilitating migraines even at 9 months. This is one of my favorite ladies. She's 93 years old. She first came in with osteoarthritis and neuropathic pain. She was using a walker. So she came into the clinic, the hallways are a little narrow. I just wanted to make sure she navigated okay. She was taking 28 pills a day between her arthritis and her neuropathic pain and her blood pressure. So started her with just CBD oil. She came back in 3 months, and I had told her, don't touch your medicines for 3 months. When you come back in 3 months, we'll talk about your pills, and I'll see, what suggestions we have in terms of changing your medication, maybe talk to your family doctor. But at the 3-month follow-up, she herself had weaned from 28 pills to 5 pills a day, and she wasn't using a walker. So there is nothing in conventional medicine I can do that gets a 93-year-old off her walker and from 28 pills down to 5. That was incredible. And she's one of the most enthusiastic follow-up people. When she comes in, lights up the whole clinic, and she has sent almost her entire nursing home to us. So everybody talks about she was in and she's got rid of her walker and she's not taking these pills anymore, and so I want to be just like her. And she's had incredible success. Another guy, 47-year-old male, smoked 2 packs per day, and he was taking 14 over-the-counter Tylenols per day for back and knee pain. He was in a manual labor job, but just because of his increasing pain, hadn't really been able to work. So we started him on a combination of CBD daytime, THC nighttime. At the 3-month follow-up, he actually had quit smoking. So that's something I see. It's a hidden benefit of CBD. People often give up sort of the bad habits, so to speak. We think that CBD works on the addiction center in the brain. And works kind of the same way that Zyban or these other products that have come out before, except CBD doesn't have all of those side effects. So I often will see people that don't think about smoking or alcohol as the reason they're coming in, but they end up quitting. So he'd quit smoking. He's like, Doc, I gave up smoking, and I'm hardly ever taking Tylenol. So, just encouraged him to keep going with the CBD. He went back to work full-time, and at his 6-month follow-up, he was actually completely off Tylenols and Advils over the counter, no smoking, and was working full-time. So much so, he was working 6 days a week, that was hard to get him in for a follow-up, so I could see how he was doing. Next patient is a 36-year-old female. She was overweight, but she happened to mention that she had done a whole bunch of different weight loss things. She'd done Jenny and Weight Watchers and Bernstein, and hadn't really lost weight that she could keep off. She lost the weight, and the weight would always come back. But she actually came in to talk about her chronic pain after a motor vehicle accident. And so she had had some soft tissue injuries, whiplash, shoulder issues, and through her family doctor, she was taking hydromorphone and Percocet for breakthrough pain. So she was on morphine long term, and then she would take Percocet in between. And one of the issues we see with morphine use, the reason the province is in such an opioid crisis, is your body adapts. So you need increasing amounts all the time. And so she, by the time she came, was up to 60 narcotic pills per week. And that's an incredible amount of pills. So when people come through Harvest Medicine, I always check their liver function, kidney function, and people's histories are accessible online to make sure there's no contraindications or anything. And her liver was starting to show some signs of inflammation. She's taking a lot of pain pills. So we talked and we put her on CBD and THC. At her 3-month follow-up, she was off all narcotics. And so again, I often will tell people, go slow. I don't expect much to happen by the 3-month follow-up. But she had actually gone from 60 to 0 and lost 10 pounds. So that was, again, one of those hidden, unlooked for, unforeseen side effects that she lost the weight. And at the 9-month follow-up, she had actually lost 20 pounds, still no narcotics. She was going for physio and some other treatments still for her motor vehicle accident, but she wasn't taking any pills for it. And her weight loss just continues. And she says, one of the things I often hear people say about CBD, when it helps on the weight point of view, is actually stops carb cravings and sweet cravings. And that's a very common experience. People will say, you know what, I've never been a salad person. I don't like vegetables. I've been a carb person, but I actually don't naturally want carbs, or I don't crave sweets as much. It's one of the reasons we actually will see diabetics drop their sugars. So in my family practice, I have 6 diabetics that with just CBD have gotten off all diabetes medicines. And that's, again, an incredible amount. At Harvest Medicine, we have 7 patients that have actually lost over 100 pounds each with just CBD. So again, incredible weight loss. Now, that's not the average experience, so I don't want you to think you're going to go on CBD and lose 100 pounds, but it does happen, and it can happen. Another patient was a 24-year-old female. She had severe endometriosis and menstrual pain. One of the interesting things about menstrual issues is that the highest concentration of CBD receptors is actually in the female reproductive system. And so we'll see a lot of benefit with chronic pelvic pain, endometriosis, menopausal symptoms. This young lady had already had 2 surgeries. She was on anti-inflammatory medication, pain pills. And so we started her on CBD daily as an anti-inflammatory, and then microscopic amounts of THC just around her menstruation and for sleep. And at her follow-up at 3 months, her pain had gone from 8 out of 10 to 4 out of 10. And follow-up at 6 months, her pain was 0 out of 10. She said she had had no pelvic endometriosis or menstrual pain at all. This guy was interesting. This is a 32-year-old male who was actually between 30 to 40 drinks per week. So, an alcoholic by every definition. He was anxious, depressed. He had a lot of chronic pain. So he, because of the addiction issues, he does not qualify for any THC. So we started him on CBD only. And at his 3-month follow-up, he was down from 30 to 40 drinks to 2 to 4. So he was like, I'm just drinking a little socially, but I always feel like that's risky for someone, who has alcohol issues. So encouraged him to increase his CBD and to abstain completely. And at his 6-month follow-up, 0 alcohol. So just completely didn't use anymore. Just want to show you guys a little amalgamation of all overall patients. So this slide is just talking about what people feel. So 62% of them feel like cannabis meets their expectations as part of their treatment plan, and really yes or somewhat is about 92%. Whether it impacts your quality of life is a good 90% of people will say that cannabis has improved their quality of life. And that's an incredible thing because, again, back in traditional medicine, I cannot think of any single thing I can do that would have a 90% impact on any of my patients' quality of life. There's nothing out there. If I could have come up with a drug that did that, I'd be living in the Bahamas, retired. So, medical cannabis for IBS on the left side, so irritable bowel, whether it helps with their condition, whether it impacts the quality of life. Again, huge results. Fibromyalgia is the same thing, positive results on both treatment plan and quality of life as well. So we track people that come through our clinic. Everybody gets questionnaires, and we're trying to see, if what we're doing is actually making a difference. Is this helping people? Also, cannabis for anxiety, you can see the results are quite staggering for the anxiety part of things, and depression as well. So both mental health stuff. Sleep, again, huge impact on the sleep part of things. Very few people, the other way to look at this is what percentage of people come to try this for sleep and find that it didn't help them. And that's, 4 to 7% of people I'm not sure. Medical cannabis for pain, again, huge results on that. I kind of already went through my story before, so I'll skip this bit. So the governing body for medical cannabis prescription in Alberta is the Alberta College of Physicians and Surgeons, and they have recommendations that they come out that all prescribing physicians have to be compliant with, and so some of these are, we can't prescribe under the age of 18. There's a list of conditions they recommend prescriptions for, and so one of the things we're known for at Harvest Medicine is to be extremely college compliant. I wanted to talk a little bit about ACMPR, which, as many of you must know, is Access to Cannabis for Medical Purposes regulation. So in Canada, there's over 10,000 physicians that provide patients with a medical document. Over 10,000 new patients are registered with ACMPR every month. Currently, over 235,000 patients are registered with ACMPR. The average amount that people use of dried herb is 2.4 grams. And the average amount of the medical prescription is 0.75. And the number of LPs is constantly changing and increasing, but we're over 100 right now. Some are growers and some are producers as well. So the ACMPR approved forms of cannabis, again, the misnomer tends to be, well, I don't want my grandmother to sit there, smoke a joint, and to help her arthritis, and she doesn't have to. The 4 approved forms, so there is the dried bud, which you don't have to smoke, you can actually vape it. Oils, which are very, very popular, you put some under your tongue, take with food. Capsules, which are really easy, because you can have them in your bag and carry them around. And then topicals. So if you have specific joints or areas of the body that need work, then that's where the topicals go. The non-ACMPR products, so these are the ones that are illegal in Canada, and a lot of people don't realize that, are the concentrates, so shatter, rosin, these types of things. The edibles are illegal in Canada. Tinctures are illegal. And vapes are illegal. So vaping is not the same as vaporizing. Vaping are these, oftentimes preloaded pens that come in with an oil and stuff, and these are the 4 illegal forms. So in the legal versus illegal, there's the sort of law issue, legality issue, but beyond that, Health Canada has really rigorous standards in who they approved as a licensed producer, and they are watched with a magnifying glass. On the illegal side, there aren't those regulations at all. So a recent study showed that 69% of these illegal CBD products actually did not contain the amount of CBD that it advertised. A large percentage of them can also be contaminated with heavy metals. The dried herb that's purchased illegally often has fungus growing in it. So if somebody is considering using it, I would highly caution you about where you get your cannabis. With, about 100 companies available, over 500 products, there really isn't much justification for going on the illegal, unmonitored side. Patients often have concerns about, what happens, what will happen if I use cannabis. So the high feeling, I don't want to be stoned all day, and that education that CBD will not stone you, you won't be high with it, is important to go. Social stigma, again, that barrier is breaking down. Most of you are here at the Cannabis Summit because hopefully you've overcome that social stigma. You're not here at a gathering of heroin addicts. So it's a whole other field. Acquisition costs, so people often have the impression that it's going to be expensive. So there's many mitigating factors to that. A lot of insurance companies now cover cannabis under their health spending accounts. It is tax deductible. Medical cannabis is tax deductible. Other stuff is not tax deductible. Many licensed producers offer financial assistance as well. So, the cost really per day does not add up to that much for what people are able to, the benefit they're able to get. And then, the last thing again is lack of understanding of the route of administration. You're not going to sit there, smoke a joint. There's all of these other ways of using medical cannabis. So who cannot get approved for medical cannabis? The two big no-nos are if you have psychosis or if you're pregnant or breastfeeding. So we don't have any research on the effects of cannabis in pregnancy and breastfeeding, so that's an absolute no-no. And psychosis, so that's if you have schizophrenia or if you had a psychotic breakdown, then those are the no-nos. The three gray areas are if you have bipolar disorder. So in bipolar, we do CBD. It really helps stabilize mood. Really caution around the THC because we don't want you to get a high from the THC. So, but bipolar is okay for CBD. Cannabis allergies, there are very few people with true cannabis allergies. Most of the time when they think they've had a reaction, it's to whatever the CBD was in. So if it's in an oil, sunflower oil allergy, or maybe a contaminant, but very rarely do people actually have cannabis allergies. And then if you have severe heart or kidney issues, so that's if you're, kind of end-stage heart, end-stage kidney. We'll always look at, and this is one of the reasons we always access your medical chart and review everything to see we're not giving you anything that could make your symptoms worse. But at Harvest Medicine, we're actually located in Calgary, Northland Mall, and above us is a dialysis clinic. So these are people with end-stage kidney disease, and the dialysis unit sends us a fair chunk of their patients who are on CBD, and we monitor their kidney function along with the kidney specialists, and it's been incredible to see how the kidney function actually improves. So we're in the process of designing a study so we can kind of document and show that. So this is where I work, Harvest Medicine, Medical Cannabis Clinic, Education Center. People often have that misnomer again that you're, to be taking cannabis, you're this young person, but our young male, but that's not the case. So we're half and half male, half female. Our average age right now is about 41, but waiting rooms are interesting because we have people in wheelchairs and strollers and canes and walkers, and our oldest patient is 104, so all spectrums are there. That was it for my talk. I'll leave some room for questions. Thanks, guys.